Imagine waving to a friend across the street, and the skin on your upper arm continues to jiggle, almost as if it has a mind of its own. This isn't just an aesthetic concern. It's a crucial clinical signal from your body, indicating an underlying issue that, if ignored, won't stay confined to your arms. After 15 years in medicine, I can confidently tell you that much of what you've heard about this problem is simply incorrect. It's not solely about being overweight, nor is it an unavoidable part of aging, and certainly not something that requires thousands of dollars in clinic treatments. What you're actually witnessing is a breakdown of connective tissue, coupled with a sluggish fluid buildup beneath the skin. A condition you can start reversing in just 5 minutes a day. Beginning today, the healthcare industry doesn't profit from you solving this at home. Clinics, cosmetic centers, and device companies thrive when you remain confused, insecure, and continue booking expensive procedures that never address the true cause. I'm here to ensure that doesn't happen to you. Join the Vitality Blueprint community by subscribing and hitting the like button. Every one of you strengthens this channel. Now, let's explore what's truly happening within your tissue in clear, understandable language. No medical jargon required. Your skin isn't a single uniform layer. Instead, visualize it as a sophisticated stack. On the very outside is the skin itself, followed by a layer known as subcutaneous fat. Essentially, the fat residing just beneath your skin. Deeper still lies a thin yet vital sheet of tissue called the superficial fascia. Think of fascia as your body's internal wrapping paper. It holds everything in place and enables different layers to glide effortlessly over each other. When these layers are healthy and receive ample blood supply, they remain mobile, supple, and firm. However, when blood circulation in a particular area becomes chronically poor, meaning consistently sluggish over months and even years, these layers stop gliding. They begin to stick together. This adhesion and thickening has a medical term: fibrosis. Fibrosis is essentially a scar-like tissue buildup that transforms soft, fluid structures into rigid, immobile ones. The back of your upper arm is, remarkably, one of the most neglected movement zones in the entire human body. Consider your daily routine. You constantly flex your arm, picking up objects, carrying bags, holding your phone, or reaching forward. Yet, the muscle running along the back of your upper arm, the triceps, which is the extensor muscle responsible for straightening your elbow, receives minimal use in typical daily activities. An extensor, by definition, is a muscle that opens or straightens a joint, unlike a flexor, which closes it. Because the triceps and the surrounding tissues on the posterior or backside of the arm reside in this movement dead zone, the microscopic circulation there becomes stagnant. Capillaries, the tiny blood vessels at the very end of our circulatory system, are the finest branches that deliver oxygen directly to cells. When capillary flow slows in a particular region, the fluid that normally moves in and out of cells begins to accumulate in the spaces between them. This leads to what clinicians term subclinical edema, a hidden fluid retention that isn't clearly visible from the outside, but quietly adds weight and puffiness to the tissue. Gravity then takes over, causing that fluid-laden, fibrotic, and poorly circulated tissue to sag. And there it is, the characteristic jiggle that greets you with every wave. Before we dive into the protocol, here's the most crucial insight I want you to grasp. This is fundamentally times, not times a fat problem. If it were merely excess fat, targeted fat loss would resolve it. However, scientifically verified targeted fat loss simply does not exist. No cream, no device, no body wrap can remove fat from a specific spot. What we are genuinely addressing here is stagnant fluid, adhered tissue layers, and a muscle that has been chronically underutilized. Once you correctly tackle these three issues, The tissue naturally tightens, not because you've burned something away, but because you've restored the underlying biology that maintains its firmness. The first step in this clinical protocol is a manual pinch massage, self-administered. I must warn you in advance, it will not feel pleasant, especially the first few times. Locate the posterior surface of your upper arm, again that's the backside, and begin taking very small pinches of skin between your fingers. And I truly mean very times small. This is where many people make a common mistake. When you grab a large, deep fold of tissue, you'll feel minimal discomfort. However, when you take a tiny, superficial pinch, targeting just the outermost layers of skin, you'll almost immediately feel a sharp, unpleasant sensation. This pain isn't random, it's clinically significant. It tells you precisely where the layers have become adherent, stuck together, and where circulation has been poor for an extended period. The discomfort directly correlates with the degree of stagnation and fibrosis in that zone. Mechanically, these small pinches are forcing a separation between the skin, the subcutaneous fat layer, and the superficial fascia. You are physically breaking those adhesions, the scar-like connections between layers that should not be fused, and re-establishing the natural gliding planes between them. The moment you do this, capillary blood flow to that area sharply increases. Oxygen rushes in, nutrients flood the tissue, and this is where the real repair process begins. The cells responsible for producing collagen, called fibroblasts, become active once more. Collagen is the structural protein that provides skin with its firmness and elasticity. When fibroblasts receive adequate oxygen and nutrients, they ramp up collagen synthesis, which simply means the body starts manufacturing new, high-quality structural protein and integrating it into the tissue. This new collagen tightens and firms the skin from within, not artificially or temporarily, but through genuine biological repair. Perform this pinching daily. Over the first 2 to 3 weeks, you'll notice something important. The pain decreases. Do not interpret this as a reason to stop. This reduction in pain is your clinical feedback, indicating that the layers are separating, the fluid is clearing, and the tissue is becoming vascularized again, meaning it has an active blood supply. Keep going. If you have a willing partner, a spouse or family member, there's an even more powerful variation of this technique. Your partner takes the skin of your posterior arm and rolls it in a wave-like motion along the surface, lifting it into a fold and pushing that fold across the skin. This technique, known as skin rolling, is commonly used in manual therapy. On a healthy, mobile back, it can actually feel quite relaxing. However, on a posterior arm with years of stagnation and adhesions, it will feel profoundly unpleasant, almost brutal, to be frank. This reaction is entirely expected and correct. It confirms the extent of work needed. With consistent repetition over days and weeks, the discomfort will sharply diminish. Each session will feel more tolerable than the last, and you will observe visible improvements in skin texture and tone as a direct result. Next, the second element of this protocol focuses on the muscle itself. The triceps, the extensor muscle located on the back of the upper arm, is chronically underloaded in the daily activities of most individuals. When a muscle is underloaded for an extended period, its tone diminishes. Muscle tone refers to the baseline level of tension a muscle maintains even at rest. A muscle with low tone is soft, poorly perfused, meaning it has weak blood flow, and provides minimal structural support to the overlying skin. Your skin absolutely needs this muscular support from beneath. Without it, even healthy skin will begin to sag, simply due to the lack of firm underlying support. The most effective, evidence-supported exercise for isolated triceps activation is the narrow grip push-up. The critical technical detail is to keep your elbows tucked in close to your rib cage throughout the entire movement. Push-ups with wide elbows tend to shift the load to the chest and shoulders, whereas keeping your elbows tight to your body places the demand directly on the triceps. If you haven't been active recently and a standard floor push-up feels too challenging, do not force it. Begin by pushing against a wall with a slight forward lean. This is a legitimate exercise, not a shortcut, as it applies genuine, progressive load to the triceps at a manageable resistance. From there, you can gradually progress to a windowsill, then a sturdy chair, and finally to the floor. Each stage progressively builds the tissue, which is the only scientifically sound method for strengthening a muscle. Progressive overload, gradually increasing the demand placed on the muscle over time, is the cornerstone of every evidence-based strength protocol available. As triceps muscle tone improves, blood flow to the entire posterior arm enhances concurrently. The muscle begins to pull the overlying tissue tighter from the inside. When combined with the manual work you're performing on the surface layers, the effects compound rapidly. The third element is stretching, and this is not merely optional filler. Evidence-based exercise medicine is unequivocal. Optimal muscle conditioning demands a 3-phase sequence. Phase 1 involves a pre-stretch, where you lengthen the muscle before loading it. Phase 2 is the strength work itself. Phase 3 is a post-stretch, where you lengthen the muscle again after loading it. This precise sequence is crucial because the blood vessels supplying a muscle function most efficiently when the tissue alternates between tension and length. Stretching after exercise accelerates the removal of metabolic waste products, the byproducts of muscle contraction that contribute to soreness and hinder recovery. It also enhances the delivery of vital nutrients to recovering muscle fibers, resulting in faster, more complete adaptation. To properly stretch your triceps, raise one arm and bend it so your hand drops behind your head. With your opposite hand, gently pull your elbow sideways and slightly backward. You will feel a distinct pull along the back and outer surface of your upper arm. This indicates your triceps and its surrounding fascia are under controlled tension. Hold this position for 20 to 30 seconds. As a valuable bonus that requires no extra time, if you simultaneously lean your torso sideways while performing this stretch, you extend the stretch into the lateral muscles of your back and the side of your trunk. I must interject with a critical warning here, as 15 years of clinical practice have taught me that someone will inevitably push too hard and risk injury. The shoulder is an exceptionally complex joint. While it boasts a wider range of motion than any other joint in the human body, that mobility comes at a cost. It is also our most unstable and vulnerable joint. If you have any history of shoulder injury, a dislocation, a rotator cuff tear, or chronic impingement, absolutely do not push through pain during these stretches. Pain in a previously injured joint is not a sign of weakness to be overcome. It is a warning signal with clinical validity. Stretching through active shoulder pain in a compromised joint can inflict real structural damage that may take months to repair. If your shoulder suffers from a long-standing problem that impacts your daily life, it requires a proper clinical evaluation, including a physical examination, imaging if indicated, and a structured rehabilitation plan. The fourth technique in this protocol involves arm swings. The mechanism here differs significantly from everything else we've discussed. This isn't about static force, it's about inertia-based loading. You swing your arm with sufficient speed and momentum so that at the end of the arc, the tissue receives a brief, powerful stretch that static positioning simply cannot replicate. As the arm whips through the swing, the triceps and fascia are pulled to an extreme length they typically cannot reach during normal, controlled movement. This intense end-range stretch, combined with a slight muscular effort required to decelerate the swing, creates a unique dual stimulus, Simultaneous deep tissue stretching and low-level strength loading occurring within the same movement. This type of combined stimulus is exceptionally efficient for improving both tissue mobility and muscular tone, which is precisely why it's utilized in sports medicine rehabilitation protocols. Now, I need to discuss something that extends far beyond just your arms. Your body is an intricately integrated system. Sagging skin on the arms rarely develops in isolation. In my clinical experience, patients exhibiting posterior arm laxity, the loose skin we've been discussing, frequently also display early changes in the jawline and neck, the abdominal wall, and sometimes even the veins of the lower legs. In more advanced cases, hernias, which are protrusions of internal tissue through a weakened structural wall in the body, can develop. All these manifestations share a common root: systemic weakening of collagen and connective tissue throughout the entire body. One of the most critically underappreciated drivers of this systemic weakening is vitamin D deficiency. Vitamin D isn't merely a nutrient for bone health. It plays a direct regulatory role in collagen synthesis at the cellular level. It acts on fibroblast receptors, the very cells that produce collagen, and upregulates their activity. To upregulate simply means to increase the output and function of a cellular process. When vitamin D levels in the blood are low, fibroblast activity is suppressed, collagen production slows, and the structural integrity of connective tissue throughout the body gradually declines. Vitamin D deficiency is extraordinarily common. Studies conducted across multiple countries consistently estimate that between 40% and 80% of adults have insufficient blood levels, varying with geography and skin pigmentation. The populations at highest risk include those who spend little time outdoors, individuals living at northern latitudes, older adults, and people with darker skin tones. The connection between vitamin D, collagen, and skin laxity is not a fringe claim. It is robustly supported by peer-reviewed biochemistry. Correcting a vitamin D deficiency doesn't just improve one symptom. It enhances tissue repair capacity across your entire body simultaneously. This translates to tighter skin, stronger ligaments, improved joint stability, healthier blood vessel walls, and enhanced immune function, all from addressing a single, easily correctable nutritional deficiency. Before considering supplementation, it is essential to get your blood level tested. The test is called a 2,5-hydroxyvitamin D, often written as 25-OAD, and it is a standard item on most blood panels. Optimal levels for tissue health are generally considered to be between 50 and 80 nanograms per milliliter. If your levels fall below this range, work with your doctor to determine an appropriate supplementation dose. Do not guess, and do not self-prescribe a megadose. There is a safe range, and staying within it is crucial. Here's something important to consider as you process all this information. The risk profile for sagging skin, collagen loss, and vitamin D deficiency changes significantly with age. After 40, collagen production naturally begins to decline. The rate of new collagen synthesis slows, while the breakdown of existing collagen continues. After 50, the visible consequences of this shift accelerate noticeably. Your body simply cannot keep up with the maintenance demands the way it could at 30. How old are you? Share your age in the comments below. I'm curious to understand where most of our viewers are in this process, as the urgency of starting this protocol genuinely differs at 35 versus 55. This insight helps me create videos that truly resonate with your current needs. Here's your actionable takeaway. Clean and simple. This is a 3-part daily protocol. First, perform manual pinch work on the posterior arm for 5 minutes to break adhesions and stimulate collagen. Second, incorporate narrow grip push-ups, progressing through whatever level your current fitness allows. Third, Complete a proper stretch sequence both before and after every push-up session. Additionally, integrate arm swings as a dynamic warm-up tool. Finally, get your vitamin D level checked and correct any deficiency if one exists. That's it. No expensive equipment, no clinic visits for healthy individuals, no creams. Just 5 to 10 minutes a day, applied consistently. And your body's biology will handle the rest, because that's precisely what your body is designed to do when given the correct input. I'm Sam Waterling, and I've spent 15 years observing patients waste money on treatments that merely address the appearance of a problem, while the actual cause continues to worsen. The skin on your arms is not your adversary. It's a messenger. Listen to what it's telling you. Address the root cause, and your entire body will benefit, not just your arms. No one in a white coat at a clinic office is going to guide you through this. There's no billing code for 5 minutes of pinching and a push-up progression. The healthcare system generates revenue from visits, procedures, and prescriptions, not from patients who effectively solve their problems at home with accurate information. That is precisely why I created this video. Subscribe to Vitality Blueprint and hit the like button. Every subscriber brings us closer to 100,000, and every one of you who shares this video is helping someone else discover the real answer instead of an expensive one.